So although it's not standard of care, preoperative chemotherapy has been utilized in a lot of patients in the United States. And so some of them only got neoadjuvant chemotherapy, but some of them also get additional adjuvant chemotherapy. So our study wanted to look at further, would this adjuvant chemotherapy in the setting of neoadjuvant chemotherapy can improve the outcome, particularly in the era that neoadjuvant chemo IO is one of the standard of care. So we look at the National Cancer Database, which is the US National Cancer Registry, covers about 70% of non-small cell lung cancer diagnosed. We included patients who have diagnosed with the clinical stage 2 to 3, who have received neoadjuvant chemotherapy. And we were able to adjust for a lot of demographic factors. More importantly, we wanted to take a look at what's the contribution of neoadjuvant chemosensitivity. The definition is very simple, just based on the stage changed between and after chemotherapy, including complete pathologic response, and those who have downstage, meaning their pathologic response stage is less than the clinical stage, and others people are not downstaged. So we identify about 2,100 patients, and about 16% of patients have received adjuvant chemotherapy among those who have already received neoadjuvant chemotherapy. Very interestingly, we show that those who have no downstage were much more likely to have received adjuvant chemotherapy. The proportion is about 20% in those who have not downstaged, about 16% in those who have downstaged, and 9% in those who have not a pathologic complete response. However, when we look at survival, we couldn't identify that even receiving more adjuvant chemotherapy, there's an improved postoperative outcome, even in those who have not achieved downstaging, meaning that in our cohort, more treatment after surgery doesn't necessarily mean improved outcome. So in conclusion, in the era of neoadjuvant chemo IO, that's becoming one of standard of care in non-small cell lung cancer, I think our study can is relevant to give some guidance in the choice of adjuvant systemic treatment in those patients.